How to reverse high-risk HPV virus and prevent abnormal cells naturally and avoid procedures and surgeries. That's exactly what I'm going to be talking about in this video. Unfortunately, so many women are told by their doctors, even their gynecologists, that there's nothing they can do to help protect themselves from high-risk HPV, that there's no way to get rid of the virus, and that there's nothing they could do or take to prevent it from causing abnormal cells. Women are told that they're going to deal with it for the rest of their life and to just watch and monitor in case it turns into cancer. If that's what your doctor told you, I'm so sorry that that's what they told you, and I'm so glad that you found this video. I would be happy to help you. I've been helping thousands of women for over 25 years to clear high-risk HPV virus to negative and to heal their cervix and to prevent the need for surgeries and to prevent it from ever coming back again. I'm Dr. Doni Wilson. I'm a naturopathic doctor, a certified professional midwife, and a certified clinical nutritionist. I specialize in helping women, and in particular, my goal is to help over 1 million women to clear HPV and prevent cervical cancer, as well as other HPV-related cancer. So you're in the right place if you're looking for a holistic approach, a natural approach, an alternative approach, herbs, nutrients, natural ways to treat high-risk HPV and heal your cervix and prevent cancer. This is what we do in my office and in my world. So I'm glad you're here. And in this video, I want to help you to understand how that's happening and what we do in order to help you to heal from HPV naturally. So the important thing I find to start off with is to understand that being exposed to high-risk HPV doesn't necessarily mean you're going to test positive. Because a lot of times what I find is women are really caught up in blaming themselves and their partner for exposing them to high-risk HPV. And while yes, of course, at some point you had to be exposed to the virus. However, simply being exposed to high-risk HPV doesn't cause you to test positive, and it doesn't necessarily cause you to have abnormal cells. Remember, over 13 million people are infected with high-risk HPV in the United States alone every year. 13 million. That's a lot. That's 80% of women by age 50 have tested positive for high-risk HPV. 4 out of 5 women will have high-risk HPV virus in their lifetime. So this is not rare. This is very common to be infected by high-risk HPV virus. I'll be talking more about what that means in a minute. The number of women who actually develop cervical cancer is about 11,000 per year. So that means that there are millions of women being exposed. There are 13 million or so being infected, and there are 11,000 that are developing cervical cancer, and that's just in the United States. But that's to show you that simply being exposed doesn't mean that you're going to test positive, and it doesn't mean you're going to get cancer. We have to look beyond that. We have to start to think about why it is that your body is testing positive at this point in your life. Remember that we have an immune system. We have a human immune system that can protect us from viruses. Just because you're exposed to a cold virus doesn't mean you're going to get the cold, right? Because your immune system can mount an immune response and protect you from the virus. The human immune system can clear high-risk HPV. Now, in years past, 30 years ago, we didn't have the kind of testing that we have now. So 30 years ago, we couldn't test the viral load of HPV. But now the testing exists. We can do a PCR analysis. We can do mRNA testing. We can actually measure whether the virus is present based on its DNA. So we can really see very clearly whether the virus is present. Most times women are being tested when they go in for a pap smear. Now, in decades past, HPV test wasn't always done. First, women would do a pap smear. We would look at the cells from the cervix to see if there's any abnormal cells that look like they're on their way to becoming cancer cells. And if there were abnormal cells, then we would do an HPV test. Now it's completely changed. The gynecological guidelines, in fact, sometimes, depending on your age, you might even have an HPV test before getting a pap smear. And so more and more women are being tested for HPV. So you might not even have been tested for it in the past. And now your doctor's more likely to run a high-risk HPV test because we know that 99% of cervical cancer is caused by high-risk HPV. And why is it called high-risk HPV? Because there's certain types of HPV that are associated with cancer. Those are the ones we call high risk. There's other types of HPV that are not associated with cancer, and those are called low risk, right? So there, if you think about it, there's over 150 kinds of HPV virus. At this point in time, we've identified 14 of them that are associated with cancer risk. So there's 14 HPV types that are associated with cancer risk, and those are the ones that your doctor's going to test for when you go for a pap smear and HPV test. So you might test positive for high-risk HPV and not have any abnormal cells. Or you might test positive for high-risk HPV and have it show that there are some abnormal cells. And those abnormal cells are on a spectrum from low grade, we call it low grade or minimal, small changes. Then those likely your body can even heal on its own or with a little bit of help. If it becomes more severe abnormal cells, because remember the high-risk HPV virus literally hijacks your cells. It can go into the cell, into the nucleus of the cell, and take over the DNA of the cell and cause the cell to look like a cancer cell. Causes that little bit by little over time, and depending on your body's susceptibilities, right? Some people, it never causes abnormal cells. Some people, it causes abnormal cells quickly. So it goes into the cell, it affects the DNA, it causes the cell to look abnormal, and that's what we see on a pap or a biopsy, is we start to see severely abnormal cells, hopefully before it turns into cancer. Because if it's before it turns into cancer, then we can remove the abnormal cells and you don't have to go through cancer treatment. And what I do then is focus on helping you to clear the virus so the cells don't come back again. If it turns into cancer, we need to do cancer treatment, and no matter what, we need to address the virus. And that's the problem with this, what's happening in the standard medical approach. The standard medical approach, if it becomes severely abnormal cells, they will remove those abnormal cells with a surgery or procedure like a LEEP procedure, a conization, or a hysterectomy. But they're not going to be able to address the virus. There is no medication that's going to help to kill the virus. And a surgery doesn't kill the virus. So what can happen is women have a procedure to remove abnormal cells, and then the virus causes abnormal cells again. And it happens over and over and over again. And maybe some of you have been through that. And I'm so sorry. The doctor didn't tell you that there's things you can do to prevent that. But now you know. Now you've met me, and now you have the answers. And I can teach you. I can show you. No matter where you are in the world, I help women from all around the world because these are things you can do from home. You can start to learn, why is it that your body's not clearing the virus? Why is it that your body's allowing the virus to cause abnormal cells? Your body has the ability to protect you. You're a human, and being a human means you have the ability to clear the virus, protect yourselves, and prevent cancer. So we got to get to it, right? We got to figure out why. And it's not the same for all of you. Everyone's different. Everyone's unique. We all have different genetics. We all have different exposures to different toxins and medications. We all have different diets. We have different stress exposure. That means that our natural approach to HPV needs to be individualized based on you, your body, and your susceptibilities. So this is what I do as I guide women, either through one-on-one care, they work with me one-on-one, even through Zoom, or they work with me in a group program. Sometimes I'm working with over 100 women at once, helping to guide them through this process of understanding what's happening in your system that's allowing this virus to show up, hang out, and cause trouble, right? If you think about it, this virus is an intruder. If it was intruding into your house, it would have meant that the door was not locked, there was no alarm system, and the virus could come right in and do whatever it wanted to. So if we think about it from your body, we have to start asking ourselves, Where are your healthy protective mechanisms? Even if we start with the immune system, right? The immune system, yes, exists in the vagina and throughout your body, and the immune system should identify the virus and start making antibodies toward the virus and the other aspects of our immune system as well. If it's not happening, we need to ask ourselves why. Why is your immune system not working as well as it could? One of the first reasons, the most common reason, is stress exposure. In fact, that's the first question I ask women. Have you been under severe amount of stress in the past 5 years? And most all of them say yes. And I ask you this question. Have you been under a lot of stress? Stress in a relationship, stress in a job, stress in your home, stress from a loss of a loved one or an animal in your life, stress from a divorce, stress from many different possible causes, abuse even. Then the stress drops your immune system, well established in the research. When we're under stress as humans, our immune system goes down. We're less able to protect ourselves from infections, including from high-risk HPV. So stress alone could explain why high-risk HPV is having an opportunity to cause abnormal cells. You see what I mean? So we need to figure out how to help your body recover from stress and how to boost your immune system back up to optimal functioning again. So the other thing that can affect the immune system is our diet, right? Even things like high sugar, like I'm talking about refined spoonful of sugar. I'm not really talking about fruit sugar. I'm talking about refined sugar. That's the real problem. We're adding it to our beverages. We're adding it to our food, even if we don't realize it. If you turn around the package and you look at what's inside, oftentimes the food has sugar in it. And that sugar lowers your immune system. So does alcohol. So if you're drinking alcohol every day or more than 3 days a week, that alcohol is also lowering your immune system and making you more susceptible to HPV. You combine those things together with lack of sleep, for example. Are you not getting 7.5 to 8 hours of sleep? Then the sleep is when our immune system's working in the night while we're sleeping. If you're not sleeping, your immune system can't protect you. So we need to get you sleeping. Are you having some days off, some time to take care of yourself? It's when we take care of ourselves, like spending time in nature, taking deep breaths, journaling, processing, taking care of ourselves, which we never learn how to do as women. We're not told to take care of ourselves. We're taught to take care of everybody else. So most times, women are so busy working and taking care of everybody else and their families, they're not taking care of themselves. I know I'm one of those people too. It's taken me, I'm still learning how to take care of myself. So if I, as a naturopathic doctor, am still learning how to take care of myself, I'm sure that you probably are too, right? We can always keep learning. How can I feed myself better? How can I sleep better? How can I take supplements? How can I do better at taking care of my body, my mind, my emotions, my spirit even, right? And that's why I use the acronym CARE to help remind us. And I'll write it all down below for you. C is for clean eating. We start there. How do we just start little by little cleaning up your diet? Adequate sleep. Let's look at if you're getting good sleep, or do we need to do some things to help improve your sleep? I can help you with that. Recovery activities. Are you getting even 5 minutes of time to breathe, journal, meditate during the day? If not, let's start figuring out how we can insert some recovery activities into each and every day. E for exercise. Are you moving? It doesn't have to mean running for 5 miles or 5K. No, start small. Start with 5 minutes of just dancing or movement or breath work. Start small. We got to learn to listen to our bodies. In fact, what I find is that most women feel separate from their bodies. Not only separate, but women feel angry at their body. Maybe you can relate to this. Feeling like you are mad at your body for this having happened to you. Or angry that your body's not protecting you. We become our worst own critic, right? We were actually programmed from a young age to be our own biggest critic. And we criticize ourselves and we criticize our body. And so we are not really working with our body to heal. We're working against our bodies. And so it makes it harder to even take care of ourselves because we're misaligned. We're not aligned with taking care of ourselves. I know how scary it is to test positive for HPV virus, and I know it's even more concerning when your gynecologist tells you that all you can do is wait and see if it continues and if it causes abnormal cells. That's exactly why, as a naturopathic doctor and midwife, that I feel so passionate about helping women to be proactive about protecting themselves from HPV virus. I've been helping thousands of women for the past 23 years to do exactly that and to get HPV to negative and stay negative. And that's why I developed the Say Goodbye to HPV online program, where you can get access to my proven protocol from wherever you are in the world. So I hope you will come check out the Say Goodbye to HPV program, review the success cases, and see if this is going to be a good fit to help you get your life back from HPV. So this is where I begin. With my patients and program participants, we start with taking care, with prioritizing ourselves, and little by little asking ourselves, what can I do to take a little bit better care of myself and my body each and every day? And as we do that, something amazing happens. Women start feeling better. Then not only does their mood improve, they tell me the anxiety goes away, the depression goes away, they start sleeping better, their energy improves, their skin improves, their hair improves, their digestion improves, everything starts getting better. And then you know what? They go in for the next pap smear and it's negative. Because now their body can actually help them clear the virus. And they can prevent it from ever coming back again, even if they're re-exposed. Because even if you're re-exposed to HPV, if your immune system's working, it can take care of it for you right there and there, and it's never going to have a chance to cause abnormal cells. So that's the beginning of it, is the lifestyle changes, the dietary changes, the taking care of you. And from there, we can go further and we can say, wait a minute, what else is making me susceptible? What else is affecting my immune system? In fact, I have identified 8 common susceptibilities that are often the things that I find are causing women to be susceptible to high-risk HPV virus. Again, number 1 is stress. Also, trauma. This is a very, very common one. What we find is childhood trauma and abuse increases risk of HPV and cervical cancer later in life. So you might start to realize, oh my gosh, yes, I did have a traumatic childhood. Yes, I did get abused in my childhood or adulthood. Both of them increase your risk of HPV and cervical cancer. Isn't that interesting? That trauma from childhood increases risk of cervical cancer, and there's research to show it. So we need to start helping you heal that. Just because it happened in your childhood doesn't mean that it gets to affect you for the rest of your life. There are ways to help you recover from stress and trauma. And that's one of the things I specialize in, is helping. We look at your biology, we look at your cortisol levels, your neurotransmitter levels, and we can re-optimize those levels using nutrients and herbs. And then we can use recovery activities and therapy and all different forms of stress recovery to help your nervous system heal and help your body heal and help your immune system heal. We also need to look for nutrient deficiencies, because this is also very common with stress exposure, but I also really find it common with women who are experiencing high-risk HPV. We need to do the right testing. Most practitioners are not trained which testing to do. So you need to work with someone like me who can get the right tests for you, to be looking for iron deficiency, vitamin D deficiency, B vitamin deficiency. Very, very common. But if we never do the tests, we will never know. So we need to teach you what are the right tests to do to find nutrient deficiencies, also to identify things like leaky gut. That's never even tested by the gastroenterologist, so you wouldn't know you have leaky gut. We need to do the right food sensitivity panel that can show us whether you have leaky gut, so then I can guide you how to heal leaky gut, because we know that gut health is related to vaginal health. So yes, we can work on healing the vagina, but we also need to work on healing your gut, including your microbiome. The microbiome are the healthy bacteria that protect us from infections. With the microbiome, we're disrupted by stress and pesticides and toxins and gluten and medications. And we disrupt our microbiome in the gut, and then we disrupt our microbiome in the vagina. And now our microbiome, which are essentially our bodyguards, they're not there to protect us from HPV. But we can heal the microbiome. There's so many things we can do to help get your microbiome back on track, and it's not going to involve antibiotics. We've probably already taken too many antibiotics. We need to help your immune system prevent infections without needing antibiotics. And we can then we can use probiotics, we can use oral probiotics, vaginal probiotics, but we can also heal the leaky gut and restore healthy bacteria. We can use herbs if we need to kill any abnormal bacteria or yeast, and we can get your healthy bacteria back on track so that they can protect you from HPV. Now, another very common scenario for women over 50 in menopause is that estrogen drops. And when estrogen drops, it makes your vaginal microbiome very susceptible to infections, including HPV. So if you're over 50 and you're not using vaginal estrogen, this is where we need to start. We need to look at how do we get you some vaginal estrogen, and this is absolutely possible. You can get it through my office, and you can get it through your gynecologist's office even. Get some vaginal estrogen. It's going to help protect you from high-risk HPV at the very least. And then we can look at these other things: microbiome, nutrients, hormones in general. Women who are menstruating sometimes have too high of estrogen, or you're not detoxifying it well. We can address that. If you have blood sugar issues, maybe blood sugar that's too high or blood sugar that's too low, pre-diabetes, all of these things make you more susceptible to high-risk HPV, but we can help with blood sugar. We can change your diet, we can support insulin. There's so much we can do. There's also genetic susceptibilities, including a gene called MTHFR, which is a gene that helps with activating folate. Folate is vitamin B9. Most people, when they're taking a vitamin or B complex or prenatal, they're still taking a product that contains folic acid, which is the inactive form. It's not going to help any. So I encourage you right now, look at your supplements. If it says folic acid, we need to replace it. We need to get you methylfolate, the active form that can actually be used by your body to make healthy cells. That's what we need to do here. We're trying to make new healthy cells on your cervix. We're going to need some methylfolate, but we also need effective clinical doses. Most products out there, and I review supplements every day. I review supplement protocols from patients every day. Most people are not taking clinically effective doses. So you might find something online and it sounds good. It might even have a few good things in there. But if they're not clinically effective doses, it's not going to work. Women come to me and say, I've tried this, I tried HCC, I tried vitamin C, I tried IVs, I tried this and this and this. And you know what? I look at what they've been taking and I say, first of all, these doses are too low. And it's not in a strategic, optimized, comprehensive plan. If you're just randomly taking, maybe it's some vitamin C or some vitamin D or some selenium and it sounds good, but if it's not in a strategic plan from someone like me who knows how to think this through, then it probably is not going to work. So it's worth it. It's worth it. If you're dealing with this and you're having to go through procedures and risk of cancer and surgery, and the doctor's not helping you, and you're trying on your own and you're not getting anywhere, you are worth it. And it is worth it for you to contact someone like me who's able to look at what you're doing and tell you exactly what needs to be different. I can tell you what needs to be different in your diet, in your supplements, herbs, mushrooms, peptides, homeopathic remedies, and vaginal suppositories. Vaginal suppositories are not available over the counter in the United States. You have to receive them through a practitioner with supervision. But I can do that. I can offer you access to vaginal suppositories that have herbs and nutrients and probiotics to help your vagina heal and help your immune system fend off HPV and protect you from it going forward. So these are all things we can do. I also want to mention that a lot of times I find that women are exposed to toxins in the environment, including mold toxins. Toxins deplete your immune system. That can make you more susceptible. Also, breast implant illness. If you have breast implants, the breast implants could be making you more susceptible to HPV. Birth control pills can make you more susceptible. So can any kind of immunosuppressive medications, such as what are used for organ transplants, autoimmunity, and any kind of allergies. If you're taking steroids, sometimes for infections, it all lowers your immune function and you become more susceptible to HPV. So we need to look at this. We can actually help you address the autoimmunity or the infections or the toxins. I can help you with all of that, even recovering from breast implant illness. so that your system can now protect you from HPV. So please know that to me, it's not impossible. It's absolutely possible to identify what's making you susceptible to HPV, help you create an effective plan to address those things, do the right testing, get the right supplements and suppositories, walk you through it. You don't have to figure this out on your own. In fact, please don't expect of yourself that you should or wish you could figure this out on your own. It's taken me over a decade of training and 25 years in clinical practice to come up with this protocol and thousands of cases, including Maria's case. Maria came to me in 2024 in complete fear. She had been dealing with high-risk HPV and had mildly abnormal cells at that time. And the fear was affecting her every day. It was affecting her work, her sleep, her relationship. And she literally came to me and said, I will do whatever I can to get this virus to go to negative because I am tired of being in such stress and fear about it. She wanted to get rid of HPV for good. So I looked at what she was taking. She was taking a lot of supplements, but they were low doses and it wasn't in a strategic plan. So I went through and I told her, you can keep taking this one, but replace this one. And we figured out exactly which supplement she needed to take. We got her the herbal nutrient vaginal suppositories to use and told her how to use them. We did testing to identify leaky gut, which foods were inflammatory for her. We did testing to figure out about her cortisol and adrenaline levels so we could address them with nutrients and herbs. We helped her to look at her estrogen levels, helped her to quit smoking. And lo and behold, within 4 months, she went back for her next exam. The abnormal cells had completely healed, cervix completely healthy, HPV completely negative. So I'm telling you that if Maria can do it, you can do it too. Sometimes it takes us getting to that point of being at our wits' end. We're like, I cannot do this another day. I will do whatever it takes. And if you're to that point, I encourage you to reach out. Even if you're not quite to that point and you're like, I don't want to get to that point. I just want this virus gone. Maybe you want to be able to go on to have a healthy pregnancy. Maybe you want to be able to go dating and you don't want to until this is gone. Maybe you just want to make sure you don't get cancer or have to have a hysterectomy. All of those are really good reasons to contact me so I can help you. You can just reach out to my office. We'll put the phone number down below and the email. You can go to drdoni.com and find me there. Set up a time to talk to my office. Send us your results. We can look at it and we can help you understand how we can help you from wherever you are. Whatever the situation is, we can look at it and we can say, okay, here's what's possible for your situation, and here's the protocol we need to follow to get you there. Again, I say this because I've helped thousands of women of all different severities, all different situations from around the world for over 25 years. So that's what gives me the confidence to say, I know it's possible for you too. So don't wait another day. So many women who come to me say, I wish I would have found you or reached out to you 6 months ago because now it's progressed. So might as well call me now. Let's get started. Let's stop HPV from causing anything to get worse, any abnormal cells. We don't want it to progress. I would rather start sooner and help you to treat HPV naturally using diet, herbs, nutrients, natural approaches. These things work. And stress recovery. I want you to know, even when you've been through trauma, I know because I've been through trauma. I've recovered from trauma and abuse. And if I can, I know you can too, and I can guide you. So please know that I'm here to help. Just reach out and we'll guide you the rest of the way. You do not have to live with HPV for the rest of your life. Thousands of women have cleared it naturally, and you can too. So I'm really glad you're here, and I look forward to hearing from you and helping you to clear high-risk HPV and prevent it from ever coming back again and prevent it from causing cancer. Let's reduce cervical cancer rates and HPV-related cancer rates together. It's not something you have to figure out on your own or do on your own. You are not alone. Even though most women are afraid to tell anyone in their life that they're dealing with this, I understand. I'm not going to judge you. You're human. Humans have sex, and humans get exposed to HPV. It's just that right now in the standard medical system around the world, they're not helping women to protect themselves from HPV and heal it and reverse it naturally. That's why I'm doing what I do. I'm the kind of person, when I see a need, I find a way to offer that to people and to animals too. I could be working in a standard clinic doing pap smears and the standard approach. That's what my training is and my certification. But I choose to create a practice and a possibility for you to be able to get help so that we can help you to break the cycle of HPV and prevent it from causing cancer once and for all, so you can go on with your life doing what you love and not have to be in constant fear of HPV. I look forward to connecting with you soon. Thanks so much for joining me. And if you haven't already, I encourage you to subscribe to How Humans Heal so you don't miss the next episode. I'll see you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.